Perimenopause refers to the time frame surrounding menopause. Now, it typically represents several years. It can be anywhere from, on average, about 5 years, but it can be 8 years. It can be up to 10 years. It really just depends on individual you and what your body's doing. This is a natural process where your body begins shutting down the production of hormones for fertility. And it begins at different ages for everyone, but we can usually see that starting to happen in our late 30s, early 40s, and it can go into our 50s sometimes for many women. I typically remind my patients that this is a perfectly normal cycle and transition, just as it was when you first started having your menses. There were probably things happening in the background. Your body was preparing you for your menstrual cycle, and then probably one day it just showed up. Well, this is that happening in reverse. The body is preparing to stop producing those fertility hormones. It represents the end of our reproductive years, but it doesn't mean life is over. It means that we're just transitioning and things start to shut down. And then one day you just won't have your period anymore. So I always tell my patients that the visual I give them is that we're these pilots and we're trying to land this plane. So when we're coming in for perimenopause, some women have a little bit of a rocky time. Maybe the plane's swaying a little bit as they're going in for a landing. But I see it as my job as your co-pilot to help you just glide in for a smooth landing. That is how nature intended. And when our hormones are a little out of balance and one is doing something, then the other one is not responding, or, we have a big difference between the two, that's when we get some of these symptoms. So that is where naturopathic medicine can help you to support you in that area. So a few things that indicate that you may be in perimenopause, and I will certainly talk more about these and highlight these as the month goes on. These are ways that your body is preparing for this transition. Many women notice that their menstrual cycle begins to change. It can lengthen, it can shorten, it can be heavier, it can be lighter. Just when you think you know your menstrual cycle in your body, it all changes. That is very true. You can also begin to experience night sweats and or hot flashes. Many women suddenly recognize that this is happening. You can begin to notice that you're not sleeping as well as you were previously. And you may also notice that you are gaining weight fairly suddenly. You may notice mood changes, or the people around you may notice mood changes that are sometimes unpleasant for all of you. You may also notice that your libido changes, and this has to do with the hormones changing, but it is a concern for many women. You may also notice dry skin and or hair loss is another one. One thing that is a little bit distressing is that you may have moments of forgetfulness where you never had that before. And there's a perfectly good explanation for it. It's just that sometimes we get a little bit alarmed when that occurs. I will also share with you many of the supplements that I've typically recommended for women during this perimenopausal time to help reduce some of those symptoms that are not preferable. Again, it's individual, and these may not cover everyone, but they're ones that are generally safe and efficacious in helping us to navigate this transition. So it's a good place to start. So perimenopause, it's a big time of life that many women struggle with. And this will be the focus of this month to help give you some information and to really help to glide you into that next stage of life. So I hope I can be of help. I'm Dr. Michelle Thatcher. Thank you for following the natural path.